Good morning. My name's David McCaleb, and on behalf of Bankers Insurance and SESCO Management Consultants, I'd like to thank you for attending and welcome you to today's webinar on ongoing COVID communications for businesses. As if some of you are familiar with SESCO, but for those who are not, I'd like to just say they were established in 1945, making them the longest standing human resource management consulting firm in the country. Our clients enjoy a relationship with them where they can access, they can have basic access to phone and email access to SESCO on all types of related topics, human resources and management consulting type topics, compensation, procedure, policy, compliance. So if you are a client, again, we welcome you. And if you already have a relationship with SESCO, fantastic. If not, and at the end of this session, if you feel like you would like to, please contact your sales executive, and they can start the process to get that going. Now, just a little housekeeping real quick before I turn this over to SESCO. There is a Q&A bar on your right. Well, it's on my right. I'm assuming it's on yours as well. But go ahead, and as you have questions, type them in there. And Jamie Hasty, who I'll introduce in just one second, will either respond to them as she sees fit, or we will also have a Q&A session toward the end. But that's how you can interact. Just type it into the Q&A and hit send, and we will be able to see those. And so also we are recording this, and I will make sure that everyone who is registered gets a link to the recording. And with all that said, I'm going to go ahead and turn it over to Jamie, who is the Vice President at SESCO Management. Welcome, Jamie.
Good morning, David, and good morning to everybody who's joined us. Oh, wait, I might be muted. Hold on. Am I muted?
No, we hear you.
Can you hear me? Okay, beautiful. Sorry. The Microsoft team flipped up a unmute your mic, but I guess they don't realize that I dialed in. So good morning. It's a pleasure to be with you. My name is Jamie Hasty. I'm Vice President with SESCO Management. And as David said, we are, in fact, the oldest HR consulting firm in the country. We've been in business since 1949. Or 45. Lord have mercy, I need more coffee. And, you know, we have the pleasure of working with clients, small, independent clients, all the way up to Fortune 100s, Fortune 500s, Fortune 1000s. So every industry across the country, which keeps us quite busy. And it's great. It's what we love. It's what we do. So this morning, you know, we're going to kind of talk a little bit more about COVID. I know you guys are probably in some ways exhausted over COVID and talking about it, but really, we're still getting questions day in and day out about the families first, or if you're in Virginia, what are the safety regulations that I have to comply with now with OSHA and returning people to work? And, you know, I'm battling absenteeism and low morale. And so all of these things are still on the forefront of running the day-to-day operations of your business. So we thought it would be a timely topic, a pertinent topic. For those of you that know me, you know I'm pretty casual. And so I kind of want to make this a little bit more free-flowing if possible. As David mentioned, you do have the QA feature. Please use that. I have it up. I'm kind of watching it as we go, and I'm going to share my screen here shortly in a minute, just because I do have some slides and talking points and that sort of thing. But please use it, and certainly when we get to the QA towards the end, if you want to unmute your mic, that's awesome too. Protect the innocent. Don't give me names, but you know, hypothetical situations are totally fine. And if you all have questions that are completely unrelated to COVID or the things that we're talking about, but you've got this wonky situation where somebody's out on medical leave and what do I do with their benefits and can I terminate them? Let's talk about it. Great. Let's use the time however you all feel is going to be best for you. You know, that's our goal here, is to make sure that you get your questions answered. Mike Atwood, thank you. He loves me because he loves elephants. Yes, meet my friend in the background. It's my favorite painting. So I appreciate that. And yes, I love elephants too. It's like this weird thing I have. So anyways, David, I'm going to share my screen so that you can push that live. Hopefully you guys can see that. I know we do have a smidge delay, so
it should be live now.
Wonderful. So, you know, as David mentioned, bankers, clients do have some basic telephone and email access to SESCO. So as these topics arise, you can certainly send questions through your sales exec or your account manager. Or if you are enrolled in the Banker SESCO's telephone and email access program, you know, you can send those questions directly to us. So, you know, that's the beautiful thing about having a partnership with bankers, is that you have access to HR consultants and HR experts in certain things. So when we talk about ongoing COVID issues, what I'm seeing, what I'm hearing, what we are really pushing is communication. At this point in time, we are pretty much almost a year into COVID. I mean, it's crazy to think we're at the end of January or towards the end of January, and COVID really hit most of us around early March. So we're pretty much coming up on a year. And when we talk about communication, first and foremost, communication is the #1 issue in every organization, by far. Yes, wages, benefits, all of these other things are struggles. But when we really dig in deep, pre-COVID and normal times, and do employee surveys and satisfaction, you know, reviews and that sort of thing, communication is always an issue in every organization. So what I'm encouraging my clients to do is remember that you can't over communicate at this point, because things are constantly changing, whether that be the rules, the regulations, what our priorities are, what our goals are, the schedule. All of these things require good communication. And it's not just telling them like it is. Here you do this, here you do that. It really is kind of changing your mindset as a business owner, as a manager, as a leader of a team, whatever your role may be, that communication is a two-way street. You know, you have to be willing to share the pertinent information in a timely manner, but also receive feedback on that information. So communication truly is going to be key. Where we're at now, where we're headed, where we're going, what their role is, and then ask the employees for their feedback. I think that's where a lot of leadership kind of at times can drop the ball. Is, you know, a lot of times we just tell them what they need to do, or tell them this is the policy change without the why behind it, and this is why. So really kind of focusing on how do we communicate in our organization? How do we get messages out about schedules or policies or changes in client needs, customer needs, change in products, or just general updates. You know, look, we had a great month, or we're struggling this month, or whatever it may be. You know, how do we normally communicate that? Is it working? And if it's not working, where are our gaps? You know, are we seeing that certain shifts or certain groups tend to have the information before other groups, or vice versa? So have a communications plan. Yes, I know you guys have 500 other million things going on, but really a communication plan, especially during COVID, can significantly make your life easier as we continue to navigate the next few months. You know, the reality is we're in the second wave, depending on where you live and work. your area may be seeing rampant outbreaks right now. I'm here in Richmond, Virginia, and our numbers are double what they were just in November. So, things are constantly changing, and our communication plan has to constantly change. How we do things and how we operate, we kind of have to be pretty flexible in that. And we have to be able to communicate that flexibility and where we're making changes. The other thing I'm seeing, actually, let me go back. The other piece of communication, what I will say is 100%, you need to be honest with your staff. If there are things going on or things that you're unsure of, they will have a better relationship, a higher trust level with you if you are transparent and honest. It's okay to say, look, I don't know. We're free flowing it this week. I don't know what's going on, but I got your back, and we're in it together. And so a couple of ways you can do that, and with regard to communication, but it kind of ties into performance management as well. First and foremost, if you're not doing annual evaluations, you need to be doing those. But secondly, it's really, really vital right now in every organization. I don't care what industry you're in. I don't care how large or small you are. You need to be doing one-on-one meetings with your staff, period. That ties into employee engagement, morale, motivation, trust, respect, which all equates to long-term retention. If you've got a good employee, you need to be able to keep that employee. And how do you keep them? You keep them by having solid relationships, good trust, good respect, good communication, and that engagement piece. So one-on-ones are really important. It doesn't have to be super formal. It doesn't have to be a coaching session about their performance or what they did wrong. Don't use the one-on-one time for that. So one-on-one time, even if it's 5 minutes where you can get quiet time with that employee. Hey, how are you doing? How's your family doing? What's working for you here and what's not working for you? What's one thing that I, as your manager, can be doing better to help you be successful? Those type of crucial conversations and that one-on-one time is really going to drive morale, motivation, and engagement. And here's the thing, folks. A lot of times people use motivation and morale synonymously, and they're not. You can have motivated staff, but the morale of your entire organization may be in the gutters, okay? Vice versa, you could have great morale, but nobody's motivated to get anything done, and they're all just playing around. So morale and motivation are not synonymous. They don't go hand in hand. They can at times if you have a great culture and you've cultivated that culture and you've worked hard and you've got good managers that are doing what they need to do, both from the operational standpoint, but from the soft skill and the people side of things. A lot of times it's very easy for us to solely focus on the technical side of the job. And I get it, trust me. I have to deal with the technical side of things all the time. But the reality is, especially during COVID, that people side of things is just as, if not more important right now than the technical side of things, depending on your industry. If you don't have people, you don't have the ability to operate the business, to service your customers or your clients or provide that product and service. So keep that in mind, that communication is really going to be a huge push right now. It's continuing to be a huge push. If you joined us back in the late summer or early fall, you heard me talk about communication because it's always an important topic, but more so important now. In terms of your culture, what I would say is, look at how your employees define your culture. have that conversation during your one-on-one. Look, David, how would you describe your culture here at ABC Company? You know, what are things that we can be doing better to improve culture or to change culture? Do we have a micromanagement culture? Do we have a supportive culture? Do we have a flexible culture? You know, all of these things are important. And I'll be quite frank, you know, the culture of many organizations has significantly shifted. And depending on your business, you may actually have all of your staff members remote working. You may have to do Zoom one-on-ones or weekly touch points to get that relationship piece and those check-ins. Or you may have still been operating where everybody, it's business as usual, everybody's in the office or the building, and, you know, nothing has really changed. So, you know, culture is changing, especially right now. People want the support, they want the flexibility, and they want choices. And I don't anticipate that that's going to change after we get past COVID one day, hopefully sooner rather than later, because the business arena has really shifted into this work from home, flexible overall culture. And I think it's going to be hard to go back to 9 to 5, everybody in the office, as we kind of move towards whatever our new normal will be once we get past COVID. So all of that plays into communication, and certainly we can talk more about it. But I think it's really, really important that you have a communications plan and that you're making sure that the information is freely flowing, but it's not just information that's being told to the employees, but we're also asking for feedback. We're also asking them if they need clarification, and it is a two-way communication street. So a couple of things that I will also say in terms of compliance. I mean, shoot, I could talk about this all day long. As a reminder, the Families First Coronavirus Act, FCRA. Keep in mind, FCRA is separate from CARES. A lot of times people try to throw those two in synonymously. And FCRA, in some ways, was a subsection of CARES, but FCRA was passed before the CARES Act was passed, okay? FCRA is that paid COVID leave, the 10 days emergency sick leave, and the up to 10 additional weeks paid for expanded FMLA. That did expire at the end of December 31st of 20. Now, a lot of questions still coming out. What did Congress do with this recent stimulus back at the beginning of January or late December? Nothing. They did nothing with FCRA, okay? So what they did say is businesses who wish to extend the paid COVID leave through the end of March 2021 can do so in totality or in part, meaning you either offer the emergency sick leave, the 10 days, or you offer the emergency or the expanded FMLA, or you offer both. It's one or the other or both. And you can still claim that tax credit for those monies paid through the first quarter of 2021 on your quarterly 941 payroll taxes. So you have the option to expand. You don't have to. You can create your own emergency sick leave policy if you so want. I would say that you need to do so compliantly. So do not craft a policy on your own. Reach out to somebody like SESCO, another employment attorney, to make sure that what you are trying to implement is going to fly in terms of federal and state law. So FCRA has expired. I will say, though, a couple of questions that have come out in the last week or two is, if somebody started FCRA, say, on December 29th, and they were out because schools went back virtual or what have you, regardless of the fact that FCRA expired on the 31st, they're still entitled to their time because they started their leave prior to the expiration date. So make sure if you had people that their time rolled into 2021 and they were still off on that leave, that they were paid appropriately, because Department of Labor is looking for you if you did not pay it correctly. So keep that in mind. The other thing I will say is that many of the states, Virginia included, are working quite swiftly to enact their own state version of paid COVID leave. Keep in mind that Virginia General Assembly just went back last week. When we were in special session back in the fall, there was a state paid COVID leave bill that was introduced. It did not make it out of committee. I anticipate that it will likely be reintroduced into the House this week or next week, if it hasn't done so already. I haven't checked the legislative tracking system this morning. So if you're in North Carolina or DC or Maryland or West Virginia or Kentucky, keep an eye on that, because that may come through, depending on how they structure it, it may come through employer payroll taxes, similar to what New York and New Jersey have done, or it may be, listen, your business, you're operating, you got to pay it, and it's not managed through the state. So be mindful of that, that, you know, states are really looking at, as we continue to navigate it, that people need some sort of paid time if they do in fact have COVID, have to quarantine, what have you. If you are a business owner here in Virginia, as a very quick reminder, the Virginia Emergency Temporary Standards, the ETS, and various other states are putting in their own OSHA safety guidelines. The ETS basically dictates to you how you bring somebody back to work when they go out from COVID. You are mandated by the state, regardless of the size of your business, to have a written infectious disease policy and to have done 2 trainings, required trainings under the Virginia ETS. Those were due back in the fall. Your plan was due back in the fall. And so, you know, you've got a 10-day, 72-hour fever-free return to work, or a 2 negative test return to work, depending on your state. Your state may not have rapid tests anymore. And so we may be back to the 3 to 5 day waiting period for those test results. So, you know, make sure that you're compliant with any safety guidelines with your respective state. If you are not, and OSHA or DOL comes in, there are hefty fines for non-compliance, and you don't get a payment plan for that. So the other thing that we are getting a lot of questions on is ACA compliance during COVID, more so in particular with counting numbers. If you have a business that is kind of on the cusp of that 50 threshold, or you may be a large employer where you furloughed or you got PPP money, you know, that there are specifics in terms of counting hours of work for ACA compliance purposes during COVID. Unfortunately, we don't have enough time to talk about that, but if you have specific questions about your organization with regard to furloughs, layoffs, PPP loans, and hours of work for purposes of eligibility to enroll or to be covered under the plan, and or how that may play into your ALE, applicable large employer status, let's talk about it offline or more specifically, because each scenario is very unique. But keep that in the back of your head, that COVID has really kind of impacted ACA compliance, and we don't want to get into a situation where we were a large employer, we didn't offer insurance, or somebody was supposed to be offered insurance or stay on the plan and we kicked them off when we shouldn't have, because remember, the IRS does impose penalties a year or so after you have filed. And then the other thing that I would say is keep a nice pulse on just your general HR laws. If you are enrolled in the SESCO Bankers Access, you should be getting the SESCO newsletter, weekly updates. If you're not, you can certainly email me. I can get you enrolled, or you can go to our SESCO website, and there is a tab on, I think it's the top right-hand corner, where you can add your email address for newsblasts and the SESCO report. So, and that just kind of keeps you in the know of all state and federal HR things that are going on. With the change in administration, not really sure what's going to happen. Typically, we do see a lot of federal law changes. I know that they are talking about a federal minimum wage increase to $15 and some other things, which again impacts a variety of compliance issues, but also how you run your business, staffing levels, a number of things. So we are continuing to monitor that as we get credible information and guidance. We don't try to create chaos if we don't know that it's likely to occur. The other thing I will tell you all is that, and again, it goes back to that communication piece that we were talking about, but I think you just have to be really flexible and kind of making operational adjustments for your business. What I would challenge you is look at your paid leave policies. Do you offer vacation sick leave or PTO bank? And I'm not saying it has to be a robust piece, but you know, do you have paid leave policies that you can put into effect that help people in the event that they need to be off from work or they were exposed? The other thing I will say is look at flexible work schedules. You know, here in Virginia, we're still operating under the guidance from the governor that really he doesn't want, Department of Labor does not want people in the office. He wants work from home if you have the ability to do so. And so, you know, unless it's a true undue hardship, and those are oftentimes very hard to prove, you really need to be staggering work schedules still. You really need to be limiting the number of people that are in the office, no more than 10, and they need to be 6 feet apart. Your employees have to be wearing masks inside all day, regardless of what industry you're in. So, you know, these day-to-day changes, the flexible work schedule, the work from home is going to remain a priority for a lot of businesses, whether that's driven because of administration requests, executive orders, safety guidelines, or whether that is part of you trying to support your employees and adjust your culture. Look at those work schedules, look at work from home. Doesn't mean that performance standards are not still in place, but quite frankly, statistically speaking, there was a national survey done, and I'm blinking right now on who conducted it, that it was done back in the fall. And basically the results came out that employees, even through COVID, who were working from home, statistically speaking, were actually more productive in their jobs, were getting more done, had a better mental health, emotional health, and were happier than they were when they were actually in the office. So take that for whatever it's worth, but we are seeing that people are just as successful working from home with or having flexible work schedules, and they're still hitting their performance standards. And when they don't, you need to hold them accountable for your policy and procedure. If you don't have an employee handbook, or your employee handbook is so out of date, please, it needs to be legally updated or reviewed or created. And you need to have attendance policies. I hear a lot of frustration every day, every week from people that are frustrated with people taking advantage of COVID, being quarantined, not following social distancing guidelines, that sort of thing. And so, you know, you need to have good policies and procedures so that you can engage in performance management fair and consistently across the board, and basically hold them accountable, verbal, written warning, second written warning, so on and so forth. I will say from a general workforce development standpoint, the screening and hiring game has changed a little bit. we have unprecedented unemployment numbers that we haven't seen in many years. And then you have the additional state stimulus that if they get approved, because we could talk about unemployment for days, they may be eligible to receive an additional federal or state subsidy for that. But I will say workforce development has changed. Even prior to COVID, it was really kind of a buyer's market, for lack of a better phrase. So, make sure that you are continuing to do good interview questions, do your due diligence with background checks, drug testing, that sort of thing. Don't change your screening and hiring practices, but know that things are moving a little bit quicker. A good place that you can post open positions is actually on your state unemployment website. You can create your own employer account and post those jobs there. Because unfortunately, a lot of people were laid off and still have not found good jobs, or they were recalled, and only to a part-time status, so they need something else to supplement. So the other thing I would say is continue to invest in your people. Training and development, employee retention, employee reward systems. Be careful with bonuses and commissions because that can create some sort of potential liability under wage and hour. So if you're going to do bonus and commission structures, reach out, let's talk about that to make sure it's structured compliantly and you know how to calculate it for purposes of overtime. But workforce development, training, education, support is going to be also vital as we continue to navigate COVID for the next few months. So I've kind of covered a lot. David, I'm going to stop sharing my screen, I think. Maybe. There we go. So I can go back on camera. And I kind of want to open it up to anybody that may have questions or comments or anything that they need.
There's one question from Justin. Do you see that one on there? Okay, or do you need me to read it to you?
Hold on, let me click this. Here we go. Okay, sorry, I had the wrong button. Justin, can you talk more about small businesses in Virginia being able to extend COVID relief through the first quarter? Absolutely. Doesn't matter whether you're a small business or a large business. Here's the thing, when FCRA went into effect back in March of last year, initially, there was that small business carve out. If you were under 50 employees, as a small business, there was a kind of misconception that you were exempt from having to do this paid COVID leave. Well, what we saw occur a few weeks, even up to 2 months after, was that DOL really kind of backtracked a little bit on that, because keep in mind, FCRA is passed by Congress. DOL, the Department of Labor, had the ability to kind of apply different interpretations of that regulation and how they chose to enforce it. So DOL came out a few weeks later and said, yes, small businesses may be able to exempt themselves from that paid COVID leave on the federal basis, but you basically have to be able to prove, if we come and challenge it, why it was truly detrimental to your business. And oh, by the way, we don't think it's going to be detrimental to your business, because basically you're getting all of that money back. You're paying that leave and you're claiming the tax credit, so it's a wash. There's no reason in the eyes of the DOL why small businesses should not have been complying with that paid FCRA leave. They basically went on the record on their website and said that. So in terms of continuing that leave, what I will say is, if you were a small business and you were doing it already, it's business as usual. The 10 days paid leave at their regular rate of pay based on their normal hours of work that they were scheduled each week. Regular rate includes all monies earned. And this is where I'm getting very technical on you. I was talking about the technical part of the job earlier, but this is the technical piece. Regular rate of pay is not necessarily the hourly rate of pay. okay? If you have somebody that's earning bonuses and commissions or is a commission-only employee, you have to do a 6-month look-back period. Regular rate is defined by total monies earned divided by hours of work for that week, okay? There is information specifically on the SESCO website under the COVID-19 resource tab at the very top of the website about FCRA, how to calculate it, because depending on the reason in which somebody is taking those 10 days paid leave, they may get 100% of their pay at a cap, or they may get 2/3 of their pay at a cap of a daily rate. But again, that expired, but you can continue business as usual through March. So if you've got people that are in quarantine or need to be off because, let's be honest, schools are all over the place. We're going back, we're not going back. You can choose, you can't choose. They may need to take that leave. With the option to extend, you don't have to do both the emergency sick leave or the expanded FMLA. You can do one or the other, or you can do both. Again, all of that information is on the SESCO website in terms of what it looks like, but in terms of the tax credit piece, I'll be honest, it's a CPA question or a payroll question, but I do know that you file your credit claim on your quarterly 941s at the end of March when you submit your quarterly taxes to the IRS. So hopefully that addressed Justin's question. Shoot me a message in the chat and I will try to answer that one. What other questions? Any questions from producers? Doesn't have to be about COVID. It could be about anything else. Oh, okay. Mike says 10 days paid leave. Is that only if employee has COVID or cares for somebody with COVID, or does it include part-time employees? Yes. Great question. So again, if you choose to extend the leave, it doesn't matter whether you're full or part-time. Again, you have to look at the hours that they're regularly scheduled as well as the monies that they regularly earn each week, and that's the money that you pay them for those 10 days. In terms of when and how they can take it, there are 6 reasons. Number 1, I've been advised by a federal, state, or local healthcare provider to quarantine due to exposure. Number 2, I was advised by a medical professional to quarantine due to exposure. Number 3, I am seeking medical treatment or a diagnosis due to potential exposure. Number 4, I am caring for somebody who has COVID or needs to quarantine. Number 5, because schools or daycares are closed, that also applies to virtual school as well, per the DOL. And number 6 is kind of a general, any other serious health condition. So those are the 6 reasons why you could potentially take your 10 days paid COVID leave. Again, if you choose optionally to continue that. So hopefully that addressed Mike's question. And then we got another question, David, can you walk me through exactly what an employer can require from them in order to validate COVID-related time off, exposure, symptoms, test results, etc.? That's a fantastic question. Some of that is going to be based on what state you operate in. So, for example, if you are here in Virginia, again, Virginia ETS dictates how you bring somebody back. Department of Labor on a federal basis has said, yes, you can request a doctor's note. However, what we are seeing from doctors is that they're not doing a whole lot of notes right now. Health department in some areas, they aren't even doing contact tracing anymore. You're not getting notified of potential exposure. So if you've got a notice from your place of employment, or you got a notice that, hey, your kid was exposed, you can ask for a copy of that notice. You can ask the employee to bring a doctor's note that says, so, Jamie Hasty was seen, or Jamie Hasty was tested, it's awaiting test results. She needs to quarantine for the next 10 days. So you can ask for that. What I would say is try not to dig your heels in completely if they don't produce that, which again is the frustrating part because it plays into absenteeism and people at times taking advantage of the COVID leave, because their provider may not be able to give that to them. The doctors are still very much overwhelmed, and they may or may not be able to get a doctor's note. Now, in my opinion, from an HR side, I want the doctor's note. Keep in mind that any medical information that you receive from your employees must go in a separate medical file under lock and key. If you were in Virginia and you were requiring them to utilize the 2 negative test results prior to return to work, then yes, you can get copies of those test results. If you're using the time-based strategy, the 10 days, 72 hours fever-free, then you can ask for a return to work, but as long as they've hit those 10 days, you can't really deny them coming back. The other thing that I will say is, as an employer, you should be doing kind of an employee pre-report to work kind of checklist, an attestation form. Have you been exposed? Have you been around anybody in the last 14 days or 10 days that has tested positive or been treated for COVID-like symptoms? Do you have a fever? Did you take your temperature before you came to work? If you're in Virginia, that's part of the Virginia ETS. You need to be doing like a pre-screening that your employees should be, regardless of size of your business. So if you're in other states, it's best practice anyways. You don't want people showing up to work that have the sniffles, that have a fever, or that think it's just a cold, but in turn it turns out to be COVID and they've wiped out your entire staff. I've got a client here in Virginia that their business owner actually traveled early December on a weekend trip, came back, had a major staff meeting with all of the department managers. And there's like 60 total employees, okay? Unbeknownst to him, he thought he just had like little sniffles, little cold. Turns out it was COVID. He got over 31 people in his business sick with COVID. It wiped out over half of his total employment, because when one gets it and you're asymptomatic and you're spreading it, it can wipe everybody out. So again, really, you need safety protocols in place. You need policy and procedure to pre-screen. They don't need to be coming to work if they're sick. And you also, if they had COVID, please know that they may still test positive even after 10 days, 30 days, 60 days, because the antibodies in their system. So that's where the test-based strategy, the 10 days, 72 hours fever-free, even though they're no longer contagious, they may still test positive. So it can create some internal conflict when you're asking them for negative tests to come back if they've had COVID, because they may still test positive with the small antibody that's still left in their system. A couple of questions. If they are out over 10 days, can you only take the credit for the 10 days? That is correct. You could only take the credit for the 10 days. And also, I will say, if you are offering or extending that paid leave in your payroll system, it needs to be coded as COVID leave, so that your CPA, your accountant knows, and the IRS knows what days are for what. Also, wage and hour wants to see true and accurate payroll records. And if you don't code it right, it looks like time worked versus time paid for 0 hours work, and you can get wonky in with overtime calculations. Mike asked, and can this be repetitive? In other words, if they were infected or exposed and have to miss work on separate periods of time. Yeah, I I see a lot of that, and that's incredibly frustrating to managers when you've got somebody that's like, it feels like every 2 weeks, they're like, oh, I was exposed. Here's the thing. If you extend the paid leave, once they use their 10 days, it's done. So if I was exposed in November and I used my 10 days back in November, I don't get 10 days again in 2021. Boom, we're done. So it's unpaid time off. That's where you can require them to use any paid normal company sick leave benefits and vacation, or they can take the time unpaid. If they are salaried, exempt, then we get into some additional pay scenarios because if they worked any time during that week, they're actually guaranteed the full salary. So if you have that situation, let me know and we can talk about that. Mike also asked, in other words, can they get paid for missing work for separate COVID events? Depends. It depends on why they're taking it, whether they use 10 days. Maybe the first time I had to go out for my own COVID exposure, and now I need to go out because my school system is staying virtual and my spouse has to go back to work and somebody needs to stay at home with kids. I may still have time under the 10 weeks EFMLA if that's extended by your company. So again, this is where we get into very specific scenarios that if you have questions about those or unique circumstances, reach out and let us know. We're happy to walk through those with you. Let's see, Brian has a question. Are there cases of long COVID starting to emerge after 10 days of paid COVID leave? What is the best course in handling additional time off? Yeah, that's a great question, Brian. So let's just hypothetically say I get COVID and I work for a large business, an ALE, over 50 employees. Keep in mind that COVID, if I have complications with COVID, may qualify under the Family Medical Leave Act. Now, granted, FMLA is unpaid leave, but I may have my 10 days paid leave, but I may be having complications, and my doctor that I've seen twice in a 30-day period may say, you need 2 more weeks off because you've got some respiratory, or we need to give you on this regimen. It may qualify under FMLA. So yeah, that leave may be extended further than the 10 days. But again, if they use those 10 days paid because you extended the optional leave, after the 10 days, there's nothing else paid. Unless, Brian mentioned, you got paid sick leave, vacation, short-term disability, long-term. And typically, short-term disability is going to kick in on day 8. So if they've exhausted the 10 days because you extended that leave, and let's just say because of complications, my doctor is not able to release me because he or she is continuing to treat me for COVID issues or pneumonia or whatever, and you're a large employer, run FMLA immediately. But also you can run short-term disability concurrent with FMLA. So great question from Brian. Justin asked, do small business employers carry any responsibility when it comes to temp help related to COVID-19? I'm not sure, Justin, that I really understand what that question means, to be fair. Maybe in part because I haven't had enough coffee this morning. So if you can unmute yourself or chat me again, maybe a little bit more specific. I'm not sure what you mean related to COVID in terms of paid leave, in terms of hours of work. I'm not really sure what specifically you want from that. Brian says, I'm guessing that we will have new guidance prior to the COVID leave program expiring at the end of March. That's a great question, great statement. Perhaps. We shall see what, again, the current administration plans to do. I wouldn't be shocked if there is another stimulus round and they codify something on the federal level that is FCRA Part 2 that gets us through June or September or what have you. But I don't want to speculate. per se. So, any other questions? Any other questions?
We can wait a minute just to see if any others come in.
Sure. Any questions unrelated to COVID? I hope it was helpful. I know we're all probably tired of talking about COVID. But it's kind of the world we live in.
It is. We're continuing to get, just as you are, we continue to get lots of questions on this topic. So.
Sure. Yep. You know, it's hard. It's frustrating. I think everybody is in kind of a challenging spot, and people are really starting to burn out. Burnout is real. You know, there's a lot of emotional and mental health challenges going on now. So I will say, as a business owner, as an HR person, remember, give your employees some grace. I know there are amazing employees out there, and there are employees out there that take advantage of policy and procedure and COVID leave and that sort of thing. We know that there are misuses of those things. We know that that's part of life, but give each other some grace.
Looks like Justin did post.
Yeah. Thank you. I appreciate that. That helps me. Okay. Justin, does the responsibility fall on the temp service when it comes to taking care of record keeping, OSHA, and other things like that? Depends on the relationship with the temp service and how your contract is written with them. But again, if OSHA comes in, your temps need to be following your policy and procedure, not their temp agency policy and procedure. So you need to have your ducks in a row and not just assume that the temp agency has those temp people covered.
Looks like Mike wants to know what your favorite color is.
My favorite color? I would say I love black, which is weird, I know. But lately I've really kind of been into green. I don't know. Thanks, Mike. I appreciate it. He always makes me laugh. I'm assuming that's Mike Atwood. So I hope this was very helpful for you all. Again, please, if you have questions, you have needs, whether you're a broker or you are a client of bankers, reach out to SESCO. You can call into the corporate telephone number, 423-764-4127. You're welcome to speak with any of the consultants in that office. Are we posting this anywhere on the internet?
We will be. We'll have this. That's a really good point. The recording I will send out to everyone who registered, and also on our website, on our blog, where the announcement is. I'm just going to post the recording there as well.
Beautiful. Okay. I asked before I give my cell phone number out. So if you want to reach me direct, my email is Jamie, Jamie, at SESCO, S as in Sam, E, S as in Sam, C-O, M as in Mary, GT.com, SESCOMGT.com. And don't share this with everybody, but if you need to get me direct, 804-931-6281. Happy to help. I don't like text messages, so try not to text me because I tend to read them and forget. So call, leave a voicemail, or shoot me an email. Happy to help. Thank you everybody for your time. I appreciate it, David. Thanks for coordinating. And everybody hang in there. Stay safe.
And thank you, Jamie, for your time. We truly appreciate it. And with that, we'll go ahead and sign off. Thank you, everybody.
Thanks.